So let's go forward. How do we rehab these things? Or like, what are next steps for people, or what would be the next step for this person? So usually the first thing I'm trying to do is educate them and reassure them. Some people don't know anything about annular ligament injuries, even though they climb, or whatever injury it is that they have that's climbing related. So I try to educate them on the injury, and I reassure them that, this is something that responds well to rehab most of the time. I do see a lot of climbers with these injuries, and so I assure them that, like, we've done this before. I've seen this for other climbers as well. So I like to make sure that they have the information that they need to feel comfortable about what's going on, and reassuring them that everything's going to be okay, and we're going to find a way to get them back to climbing. And then we talk about rehab and load management. So first thing we're going to do is find a starting point for rehab. So let's find out what we can do to load their finger. And where's their starting point? Is it going to be 5 pounds on this thing, or are they going to be actually hangboarding? And I actually have a hangboard and these other devices in my clinic that we can use to look at that. I also have a crane scale, so if we want, we can measure it that way. I just use the load as a way to measure most of the time. And then we're also talking about, like I mentioned earlier, like, how much do they climb? What's normal for them? What are they doing now? What are they able to do now? If they're not sure, then we can have them go into the gym and find out what they can do. And for me, I like to keep their climbing sessions, at least initially, like pretty pain-free, because I want to get a good read on how the hangboarding is, how they're tolerating the hangboarding, basically. And if they're doing climbing and they're not navigating that well, and then they're also doing like the hangboarding, and then their fingers like still hurting, or it's like not responding well, then it can be really hard to tell, like, okay, is it the climbing that you're still doing, or is it the hangboard? Like, we're not sure. So I want them to keep climbing, but like initially, until we get an idea of like how they're going to respond to the rehab side of things, we're keeping the climbing like pretty pain-free at the beginning. So we're discussing that with the patient. And then I'm looking at their mindset and their buy-in. I kind of hate the word buy-in because it sounds like kind of sleazy salesman guy to me, but you guys know what I mean. I want to find out like how comfortable they feel about loading their finger, obviously, because if they're really scared of it, we're gonna have to probably take it a little more slowly, or we're gonna have to talk about like why this is okay to do. And then I want to find out like how confident they feel in the plan. And it's a really important thing to ask, and you'll be surprised when you talk to people, because you think that they're on board, and then you're like, so how do you feel about this plan? Like, what do you think? They're like, I don't know. I don't understand how this is going to work. Like, I don't understand how this helps. Like, I've had people say that, and then so we have to have a conversation about that, because if they don't understand how the rehab's going to help them, then it's probably not going to help them. So that's really, really important. And then also making sure that they understand the plan too, which we're going to talk about the plan in a second. But I really want to make sure that they understand how the plan works, like how the rehab actually works.